I am coming to you from the newly constructed National Isolation Center here in Manyago, Entebbe municipality, and this is an 80-bed capacity that the Ministry of Health is expected today to come and inspect, and it's a reliever facility to the Entebbe Regional Referral Hospital, which is overwhelmed with the COVID-19 patients. And actually, this place has been under renovation since 2019, and by this time, we are told it is ready, and the Ministry of Health officials are expected to be here later on in the day to inspect. This is one of the wards, and just like you can see, the beds already that have been installed and waiting for an official whistle that will be blown by the Ministry of Health. According to Entebbe Regional Referral Hospital, when this facility is complete, when this facility is handed over to them, there will be actually a reliever. There will be now space for them to admit more patients, given the fact that as we speak, it is overwhelmed. The capacity is even beyond what they expected, and when this will be handed over to them, it will be a reliever. But well, if I can just walk you around, just away from this ward, we also have more other wards the other side. If you can see, there are many others this side, but let me just talk to a gentleman, the people who have been behind these works, to just let us know what is inside here. What has been delaying the process of completing this one?
You see, first of all, my name is Sona Henry Seka. I'm a civil engineer from BMK Uganda Limited. The facility is a bit complex.
Yeah, you can walk us around it.
Given the nature of
Let me turn this side, yes.
Given the nature of the disease we are handling at the moment, the pandemic is very sensitive that it needs critical attention. We have been receiving a number of consultants from Ministry of Health and World Health Organization. They have been coming around and giving us advice on changes that could be made every now and then. Actually, it's those changes that have been coming every now and then to make the facility functional that they are the one that have caused us the delay.
If we go on, and probably we see the other side, yes. So yeah, you've been receiving consultants to give you advice on how best you can do it?
Yeah.
Yeah. And can you now tell us this facility is ready for use?
Apparently, as a contractor, I can confirm that the facility is ready for use. However, we're waiting for the final inspection from the Ministry of Health and the consultant later in a day. They are, after inspection, they will tell us the exact date and exact time when we can give in this facility. However, at the moment, for us, we feel it's ready and fit for use.
Yeah, we know very well that you have been receiving consultants to advise you on what to do A and B, but some of the other technical glitches. Last time we were here, I think there was a shift in the contract and all those the other related. But as we speak today, what are some of the parting shots you are doing for this isolation center? The last tackles you're doing?
Actually, as I speak now, we're doing the final touches in terms of doing the final painting, but the rest of the things are done, completely done and ready to be given out. We've done finalized with painting, we've done with the electricity, we've done with the M&E, everything is finished. So we're just waiting for the final inspection. Whatever that comes up is what we, in case the advice to add up anything, because anything, we shall have to do it, and then they'll have to specify the time frame at which they need this, the facility.
I initially said it's an 80-bed capacity, and that's the initial information I had from the bar. Has there been an extension, an increase, perhaps in the capacity?
The capacity at the moment, it has to be, what we found is what we're supposed to do, and we have not changed the structure, the capacity of the facility. However, in case there is a need, the administration shall decide in case they want to use some of the rooms as bed space for the patients, given the number of the overwhelming numbers of the patients, they will do it. However, according to the plan, they haven't extended the structure.
Well, and are you able to tell us that if the Ministry of Health officials say the facility is ready, tomorrow it can even start the works?
Definitely.
Wow. Thank you very much for talking to us.
Thank you so much.
Well, he is the gentleman, the team that is behind all these beautiful works. But while from an administrative point of view from Entebbe Regional Referral Hospital, the administration says even if the works, the renovation works are done, there are still more other technical works that should be done. For example, the oxygen plant and the many others that are needed to also be used while taking care of the COVID-19 patients. So we do not know when this will be done, but hopefully, according to the gentleman, I think by the end of next week, this facility will be handed over, or this week, we do not know. But he says as soon as it is handed over to the Ministry of Health, the other installations of oxygen, among others, will also start immediately. And we wait to see, like I earlier said, the Ministry of Health officials are expected in this area to do an inspection work, out of which they will have to inform the Entebbe Regional Referral whether this facility is ready for use or not. We're also keeping tabs on what transpires, and we'll let our audience know